Hi, so I want to begin by sharing a bit about my background because this is where the foundation of my nursing philosophy and ultimately my personal nursing motto originates. Growing up, I was taught the importance of values and how deeply our actions can affect other people. Both of my parents work in the medical field, so from a young age, I had a front row seat to the resilience, the purpose, and the sense of fulfillment that healthcare can bring. Watching them taught me that my nursing job is not just a job. It is a way of moving through the world, a collection of values, skills, and attitudes that extend far beyond the walls of the hospital. Over the years, certain values have become central to who I am and who I am becoming as a nurse. Compassion, equality, dedication, determination, and passion. These values shape the way I view nursing, the way I hope to care for my patients, and the kind of professional I aspire to be. This brings me to my personal nursing motto. Life is inherently challenging, and without health, people are left struggling. As nurses, we have the ability to make a direct positive impact during someone's most difficult moments. By implementing compassion, dedication, determination, equality, and passion, we can be the light in people's darkest moments. The first point I want to touch on is nursing theory by Gene Watson's theory of human caring. Throughout my nursing education, one theory consistently stood out to me, Gene Watson's theory of human caring. Watson emphasizes caring for the whole person, mind, body, and spirit. Instead of viewing illness as something purely physical, her theory focuses on the human-to-human connection between nurses and patients. It centers on the idea that caring is the core of the nursing practice. My connection to this theory is deeply personal. Last year, my grandfather had a stroke. Growing up, he was someone I viewed as strong, independent, and endlessly supportive. Seeing him suddenly unable to perform tasks he once did without a second thought was incredibly difficult. As I helped him relearn how to walk and engage in daily activities, I realized how essential it is to protect a patient's dignity, especially when they're in their most vulnerable moments. Dignity in nursing means recognizing the inherent worth of every person, no matter their health, background, or circumstance. It means preserving privacy, respecting beliefs, involving patients in decisions, and speaking with kindness even when the situation is stressful. My experience with my grandfather helped me fully grasp the importance of this, but was reinforced again during my last rotation. During my last rotation, we had a cancer patient who required multiple invasive interventions. During one of these procedures, the nurse I was assigned to move quickly and did not draw the curtain or check in with the patient before beginning. I, on the other hand, made it a point to pause, draw the curtain, and ask the patient if he was ready, and offer water or any other way I can comfort him. That moment reminded me that dignity is not a luxury, it is a necessity, and it is a responsibility that belongs to each of us as nurses. The second point I want to touch on is the value of compassion. Compassion is another value that is often mentioned in healthcare, and for good reason. Unlike technical skills, compassion doesn't require formal training. It simply requires a willingness to see another person's humanity. But while compassion may come naturally, maintaining it over time is not always easy. Nursing is demanding. Nurses carry heavy workloads, face emotional exhaustion, and are exposed to trauma. Burnout and compassion fatigue are very real experiences. In my senior capstone on PTSD and nursing, compassion fatigue stood out to me as a major contributor to the emotional toll nurses face. Compassion fatigue is the intersection of burnout and secondary traumatic stress, which is the emotional weight we absorb when caring for others in crisis. The longer nurses work, the more this emotional burden can build if it goes unaddressed. We've all met nurses who have been in the field for decades and seem worn down, detached, and impatient. This isn't because they're bad nurses, it's because they've carried years of emotional labor with little support. One of the most important ways to combat this is through compassion satisfaction, finding meaningful and fulfillment in the act of caring. When leadership provides support, when teamwork is strong, and when self-care is prioritized, nurses can maintain compassion without burnout. My passion for compassion grew especially during my early clinical experiences in long-term care. Many residents didn't want to be there. Many felt lonely, forgotten, or frustrated. But small actions, taking a few minutes to chat, offering comfort, showing genuine interest, made noticeable differences. As cliche as it might sound, treating others as we would want to be treated is truly the golden rule for compassion in nursing. The next aspect I'd like to touch on is program outcome number 6, excellence, innovation, and lifelong learning. One PLU program outcome that deeply resonates with me is pursuing practice excellence, lifelong learning, and professional engagement. Through all of my clinical experiences, I've learned that excellence does not come from knowing everything, it comes from being willing to learn continuously. Healthcare is constantly changing, new research emerges, new medications are developed, and new technologies shape the way we provide care. To offer safe, effective, and up-to-date care, nurses must commit to being lifelong learners. During my clinical rotations, I grew the most when I stepped out of my comfort zone, whether that meant performing a new skill, asking a question, or observing a complex procedure. I realized that patient safety depends on being engaged, asking for clarification, and seeking feedback. As I move forward in my nursing career, I'm committed to continue my education, earning additional certifications, and staying actively involved in the nursing community. Excellence is not a destination, it is a continuous process. And innovation, collaboration, and curiosity are what pushes healthcare forward and allow nurses to improve patient outcomes. The next PLU program outcome I want to touch on is understanding how healthcare policy influences care delivery and health outcomes. To me, equity is one of the most critical components of ethical nursing practice. Everyone deserves high-quality care, regardless of their financial status, background, culture, or health condition. Unfortunately, the reality of the U.S. healthcare system is that many individuals face significant barriers to receiving equitable care. Limited insurance, lack of access, and transportation challenges are systematic biases. Equality means giving everyone the same resources. Equity means giving people the resources they need based on their circumstances, and those are not the same thing. Madeline Langer's cultural care theory emphasized the importance of providing care that is culturally congruent and responsive to each patient's unique background. This theory aligns closely with equity because it acknowledges that people come from different places, face different challenges, and therefore require individual approaches. As nurses, we must advocate for systems that support fairness, respect diversity, and promote health for all people, not just those with the most access or privilege. Equity is not just a policy issue, it is a moral responsibility. As I reflect on my nursing journey, my motto, my values, and the theories and program outcomes that resonate with me, I feel confident in the nurse I am becoming. My philosophy is rooted in compassion, dignity, equity, and lifelong learning. I believe nurses have the power to positively impact people during the hardest moments of their lives, and I'm committed to carrying that responsibility with intentionality and heart. Thank you.